Hey guys, it's Natalie Hodson here, and I'm here with Dr. Monique Middlekauff. And we are, for the next couple of weeks, every single Tuesday at 11 o'clock, we're going to hop on here live and answer any questions that you guys have about diastasis recti, which is separation of your abdominal muscles, about pelvic floor dysfunction, which could be things like peeing your pants when you exercise or laugh, cough, or sneeze, or even more sensitive topics like prolapse. And our hope is that we can just open up the conversation on these kind of topics and just educate as many people as possible, kind of reduce the shame or the embarrassment around some of these topics. Things like, I used to be really embarrassed to admit that I used to pee my pants when I exercise until I learned that it can be improved and all those types of things. So we have a bunch of comments that are coming in. So we do know that this is kind of a heavy topic, and sometimes we talk about things that make it just is a little bit heavy. So we thought we'd start it off with maybe a little bit of a lighter topic here, and ask you guys, are you guys reading any books right now for this summer? Like, what books are you reading? What are you loving and enjoying? Monique, what's your favorite right now?
Okay, I'm a big reader, and I just finished two books that I thought were spectacular. So the first one, it's from an author called Bobby Bones, and his book, the title is Fail Until You Don't. It's a super conversational, entertaining book. If you haven't read it, it's such a good one, and it's really encouraging for those of us who are like really perfectionist driven. And it was just so awesome. I love that one. And I also just finished one this past weekend that I was captivated. It was so crazy. It's called Educated, and let me think. Tara Westover is her name, and it's about this lady who grew up in a family who didn't believe in formal education. I also didn't believe in any sort of medical intervention. And then her story, as she's kind of reflecting back on her life, she's a Cambridge graduate with a PhD, and I was riveted. Oh my gosh, Educated.
Oh my gosh. I saw your Insta story on that, and it got me really intrigued. Like, I'm really, really interested to see, like, does she, like, can you just say, will it spoil it? Like, is she happy with the way that she was raised, or is she not?
It's sort of told like a story. So she talks about just kind of some of her growth and development and some of the things that she would look back and be like, whoa, not okay. And other things she'd be like, okay, I'm still seeking approval. Or I just absolutely read it. I don't want to give anything away, but gosh darn it, it was entertaining. I couldn't put it down.
That's so awesome. I can't wait to pick it up. If you guys are reading any books, leave them in the comments below. I can't talk. When I say reading, I really mean listening, because I do a lot of Audible. But I've been listening to this book called Girl Wash Your Face, and I've just seen it all over. I've seen everybody posting about it. So I thought, well, I guess I'll read it. And I'm only I'm like 3 chapters in right now. And so far it's really good. It's all about this woman. I can't think of her name off the top of my head, but
Rachel Hollis.
Yes, Rachel Hall. And she just basically puts all of her failures out on a platter and was like, this is how I worked through it, or this is how I did it, and this is what I learned from it. So I'm really enjoying it.
Yeah, I like that
awesome.
One too. Good.
Okay, cool. So we have a bunch of questions that are coming in. And then, so before I hop into those, I know one of the things we wanted to talk about this week was bring up the topic of hypertonic pelvic floor. And Monique is definitely the expert on this, so I will let her kind of take it from here. But we've been getting quite a few questions on this specific issue, and so we wanted to bring it up.
Oh, I'm so glad. Okay, so I think most of us tend to be a bit more familiar with having a weak pelvic floor, or maybe when we think about pelvic floor dysfunction, our mind tends to think about laxity. And often we don't think about the other side of the spectrum, which is having a hypertonic pelvic floor. Sometimes it's also called an overactive pelvic floor. Sometimes it's also called levator ani syndrome. Those would all describe the same concept of having a pelvic floor that can't relax. So just like muscles are made to have movement of both kind of expanding or going through like an extension, and then also going through a flexion or contraction. And in our pelvic floor, if we just have maybe an overactive tendency to hold a contraction without the ability to relax down, it changes our mechanics in our entire core, because we know that it's not just our abdomen. When we think about our core, it's not just our abs, right? It's talking about the whole system of the top and the bottom and the sides, front to back. And that system, when we have one part that's too tight, it can create a lot of problems. Like incontinence is one issue, but we can also have issues with emptying, having a difficult time getting everything out. Maybe urge incontinence where we have to go right now. Things with back pain can happen because we don't have that ability to, when we breathe in, our diaphragm pushes down, which pushes our organs down and ideally expanding the pelvic floor. That's part of that system. But when that system's too tight, it can create a lot of issues. So having a hypertonic pelvic floor is not something that everyone would know right off the bat, but if you have symptoms, having a consultation with a women's health PT or seeing your urogynecologist or your OBGYN, it's an awesome place to start to know where do my issues lie and then what do I need to do to fix it.
Awesome. Cool.
Awesome.
That's great.
Cool.
That's great. Ooh, I'm getting an echo here.
Are you?
Oh,
I don't hear you echoed.
okay. Well, freaking me out. Hold on. Okay. Well, can you guys hear echo? What is going on here? Leave a comment and let me know if you hear an echo.
Yeah.
Okay.
From my end, I think we're good on my end, but I'm not sure how it's transmitting.
Okay. Until I figure this out, let you answer a lot of these questions. Okay.
You got it. Ask me.
Okay. We have a ton of questions coming in. So Mom asked a great question. She says, how does the pessary help?
Oh, okay. It's a great question. So a pessary is a device that's inserted into the vagina. And I like to think of, if you've never seen one before, it kind of looks like a binky, like a baby binky, where it has like some plastic pieces, or it's really just one plastic piece. And it's used to help kind of serve as an internal anchor. And that anchor helps to keep the organs in place. So for prolapse, a pessary is really helpful, especially if you're doing higher impact activity, because it's kind of like an internal brace. Sometimes we brace things from the outside, but a pessary is kind of like an internal brace to help hold the uterus in the right position. And also sometimes it can help take a little extra pressure off of the urethra. If you're having a hard time with being able to completely void, sometimes having some extra pressure on the urethra can help stop some incontinence issues, but taking off that pressure can also help women go if they're having a difficult time with voiding.
Yeah, that's really helpful.
If you Google a pessary, there's tons of images so that you can kind of see exactly what that looks like outside of the body, and then some internal diagrams just to help give another picture if you haven't seen it before.
Cool. I feel like I can't even talk because I'm so sorry.
Oh no. Okay. Could you turn down the volume on your computer? Does that make any difference, Natalie?
Let me see. Hold on.
Like maybe just the speaker volume coming back.
Okay, is this better? Maybe perhaps this will work a little bit better. I can still hear a little bit of an echo. Okay. So, let's see. Shelby says, can I work out on a row machine if I have diastasis recti?
Oh, it's a great question. So intensity is going to be different for every single person. So if you kind of think about a spectrum of things that would be kind of low intensity and high intensity, depending on your fitness level, that might be an activity that would be really challenging for some people who have lower fitness, and it might be really easy for those who are in the higher fitness levels. Oh, you're absolutely right. I just saw the comment. It just popped up on my screen too. Yes, it can be really painful. But that's going to be something that is going to be intensity dictated rather than movement dictated. We typically don't say as a whole that some movements are bad, and no, you don't want to do rowing if you have diastasis recti, but you do want to do things at a lower intensity, because having lower intra-abdominal pressure is going to help your body heal and recover. If we have high intra-abdominal pressure and you're doing that activity at a really high level, maybe with high speed or using a really forceful pull, that can be really problematic. So it's going to be a little bit different for everyone. That's not a super fun answer to give, but keep the intensity low to keep the pressure low.
Definitely. I 100% agree. Couldn't have said that any better. Caitlin asked a question. Can you have pelvic floor dysfunction symptoms, prolapse and pull, and not have diastasis, or do they go hand in hand? And I had this question when I first started. It doesn't really. are thinking about it. At first, it doesn't make sense. Why would the separation in my abs have anything to do with why I'm peeing my pants? And it wasn't until I really started to understand this word intra-abdominal pressure, and that's like the key to everything, right? So I used to think my core was just muscles of six-pack. And it wasn't until I really started to learn that your core, the muscles, your abdominal muscles, it's up here by the diaphragm, it's the muscles around the spine, and it's the muscles. So they all work together, not just one that we're looking at. So we have this amount of intra-abdominal pressure that everybody has, male, female, it's normal, that's what kind of keeps everything in place. But what can happen is if you have a weak connective tissue here that's holding those muscles together, that intra-abdominal pressure can either go out, causing an ab separation, or it can go down, causing you to have pelvic floor dysfunction, like in your pants and things like that. And my mom can add some more to that too, but that's kind of how I wrap my head around. That makes sense. My this ab separation is connected to this, peeing my pants.
Yeah. And to specifically answer that, Caitlin, no, they don't have to be always occurring together, but most often they do, like over 70% of the time. So it's not that we would ever look at the whole core as a whole and say, could you have incontinence without having any diastasis recti? Because that answer would be yes, you absolutely can have them. But I think it's really helpful from a proactive perspective also to know, okay, if I have diastasis recti, if I have pelvic floor dysfunction, let's look at how the core is functioning as a whole, because it all works together, kind of like that piston system where pressure in one area really does, just like Natalie said, it affects pressure in the other area. So you can certainly have them individually, but they're often connected and correlated.
Okay, I switched my speakers.
Is that echo? You're super clear on my side, Natalie, but I don't know how it's coming across on their side.
Everybody's commenting and saying too much echo. So what I'm going to do is I'm going to my and if you don't mind, I'll let you.
No, I don't mind at all. Gosh darn it, Natalie, we're missing out on your perspective and your wisdom, though.
I know, didn't it? Okay. So do you want to read that out loud?
Oh, sure. Okay. So Vince asks, hi, Natalie. My wife, Jennifer, has done several of your workouts, including abs core pelvic floor. It turns out I have diastasis recti. I was wondering if I could use this plan, obviously leaving out the exercise parts I don't have. Yes, Vince, that's such a good question. And I actually think that often we don't talk about diastasis recti in males, and it's actually pretty common. Sometimes we associate just having diastasis recti in cases where we have pregnancy. And that's certainly one way, but especially even people that we wouldn't think about, like male power lifters and weightlifters, because of that intra-abdominal pressure can cause a lot of separation. Or if we have just an increased circumference of our abdomen, that same internal pressure pressing out can help create that separation as well. Or maybe a better way to say it is to cause the separation. So yes, Vince, you can absolutely do the exercise. Anatomically speaking, from the core stabilizers, they're almost identical in males and females. So it would be absolutely appropriate to use the same exercise. Now, obviously, in our abs core pelvic floor program, we do specifically discuss some things that are related to delivery and pelvic floor dysfunction in ways that wouldn't apply to you perfectly. So just like you said, anything that has like a vaginal contraction, just leave that out.
Yes. Okay. I don't know why I'm having this.
Oh, gotcha. Okay. I just saw this question come across my screen. Allison asked, how can you tell if you have diastasis recti if you have too much abdominal fat and can't do the finger test? Yeah, absolutely. And I think we might have even touched on this last week too, but it's a common question because often the way that we look at the separation is by just palpating using our fingers. And that's an easy way to check from the outside. But an ultrasound test is a test where we just use an external implement to look internally. And that's a wonderful way to look at the separation as well. So if it's something that your healthcare provider has maybe decided that that would be a good option for you, it's a great test and it has really high reproducibility with the results. So it's worth walking down that road if you suspect that it's something you're concerned about.
Awesome. I wonder, can you guys completely mute my camera when I'm talking to you guys to hear an echo? Let me know, because so many people are commenting, try this, try that. My headphones are in the other room, so I might go grab those. Okay, so many good questions that have come in. Nicole says, can I add weight to my squats even though I have diastasis? Or is that going to cause too much pressure and make it worse? So that's really similar to the rowing question that we had earlier. And Monique, I'll let you take that until people comment and let me know if there's still an echo.
Yeah, you bet. Okay, so that again, it's going to be really individually determined. So if you're in the early stages of healing where you have really weak and kind of frail tissue, for lack of a better word, that probably is a time that we want to reduce all of the extra pressure. So if you're in those early stages, I really recommend just taking off some of the extra weight. If you're in the later stages and you're not having any extra symptoms, that can be a good way to start to increase the intensity, right? Because we don't want to stay in that low pressure zone forever. If you'd like to get back to higher intensity activity, heck yeah, right? Being fit and healthy is fantastic, but use gradual increases in weight, because then you can kind of know what your threshold is based on what creates those additional symptoms, or having maybe even symptoms return from previously doing lower intensity exercise. So you can use that as a threshold and then know, oh, that's where we're going to work up to and then push towards later.
Awesome. Perfect. Julia says, why when your kids hug you or it touches anything?
Is that related to the abdominal pain, just like sensitivity in your abdominal wall?
That's what I would assume. That came in there.
Gotcha. Yeah, I'm not exactly certain. I mean, we'd certainly, especially if you've had a C-section, sometimes those incisions can be really painful, especially initially. And if you have pain that's not resolving, I really recommend going to see your healthcare provider. Just give it a check, because we want to make sure that nothing else is going on as well. There's a lot of things that we can do ourselves, but there's also wisdom in really seeking care.
Totally. Liza, thank you. She said, this is the best program. I can now see. Yeah, you guys know, like, I never get tired of hearing positive comments come back from you guys about the program. Like, it's awesome. I never get tired. Okay. Anna says, I have a hypertonic diaphragm, and that's what's causing. Is that what is causing the pelvic floor dysfunction?
And that's, oh, okay. So absolutely. So any muscle that we have in our body is really made to contract and expand, and we really want to think about using that in our entire body, of finding ways to make sure that we don't have additional flexibility. Now, there's some things that might be out of our control, and if we do have a hypertonic diaphragm, you're working on it, and it's part of that is out of our control. We just work around it to see how can we improve the other portions of our body to maybe create healthy compensations instead of compensations that are going to lead to additional issues down the road. So it's really nice, and I love that you know what's going on in your body. That's crucial, to know what's happening in your body, and then how you can just make positive changes to help get your body even stronger and more stable.
Perfect. We answered this one last week, but I think it's worth addressing again this week because it seems to be a consistent question. How can you tell if you have too much abdominal fat and you can't do the finger test that's on the YouTube channel?
Yes. Natalie, I just actually answered this one just about 3 minutes ago, just when you were right in your echo spot. So yes, I actually answered this one for Allison. So thanks for pulling it back up. But yes, ultrasounds are a great option if you need to kind of go down that pathway.
Perfect. Sorry, I was trying.
I knew you were. No problem. No worries.
Okay. Can you guys comment and let me know when I read? Like, are you guys hearing an echo right now? Leave a comment and let me know, yes or no. Jody says, I don't have any pain, just all of a sudden not being able to run or do high impact exercises anymore due to having to pee my pants every time.
Yeah. Okay. So most people might know about the broad term of incontinence, just meaning that we're having accidental leakage for any reason. But there's multiple types of incontinence, and I think this is a really wonderful example of a potential stress incontinence. And so stress incontinence is anytime we have too much pressure that kind of breaks the threshold of what our body is able to withstand. So when we do things like laughing or coughing or sneezing or running or high impact exercise, just like what Jody had mentioned, when we break the threshold by producing too much internal pressure that our pelvic floor muscles aren't able to hold and support that pressure appropriately, it gets pushed towards the bladder. And as the bladder has a lot of extra pressure pushing down, it can cause some leakage. So it's actually really encouraging because pelvic floor exercise is really helpful in improving stress urinary incontinence. And I think that's really wonderful because when we know that we have treatments that really work, hey, right, it's a home run. So doing pelvic floor strengthening exercises can be extremely helpful in reducing the symptoms of stress urinary incontinence. So I really encourage you, if you haven't already, Abs Core Pelvic Floor literally addresses exactly that. This is our bread and butter. This is what we do. And it works. Pelvic floor strengthening programs as a whole work for about 80% of women with stress urinary incontinence. So I think that's a massively high success rate. And it's wonderful when we do things systematically, when we do them on purpose, and we do them with the right amount of intensity and rest, we can create a lot of changes. Our body likes to change and improve. So I encourage you, if you haven't already, this is literally what the program's for. It works so well for this.
Awesome. So, sorry, it's echoing. I'm not going to talk.
Shoot! Sorry, Natalie. Goodness.
Okay. So let's. We got a lot of good questions. So Monique, if you want to read it,
Yeah, you got it. Okay, Holly, the question knows, will this work if I've had 3 C-sections and my last was 2 years ago? I do have diastasis recti. Holly, I think one of the most beautiful things that I love about our body is the ability to regenerate. Cells repair and they regenerate, and it's a wonderful thing. So we can't say for sure that yes, a program will work for a person every single time. We can't say that, but we can say that when we really look at how our body is structured, and especially when things are sewn back together even after a C-section, that there's an unlimited capacity to change. And whether that was maybe you had a child 1 year ago, 6 months ago, 10 years ago, our body is willing to respond to the stimulus that we provide. So I would say absolutely give it a try, because systematic exercise makes such a difference in our body and helps us feel stronger, feel better when we're using the right breathing mechanics, when we're using the right posture and stability and the right exercise. It's the ideal environment to give our body every possible chance to heal and improve.
Awesome. Perfect. This is a really good question if you want to read it from Maria.
Okay, Maria, my mom is 79 and I'm 55, and we both sometimes let go when sneezing or coughing. Super common. My mom especially. I do Pilates 3 times a week and yoga. Am I just too hydrated? Awesome question. Okay, so let's first address, am I just too hydrated? So that's kind of a common thought is maybe I'm drinking too much water and that's why I'm having incontinence. Well, we don't want to limit our hydration to the point where we are dehydrated. That's actually a big problem. So what we want to do is think about how can we use our intake of water throughout the day to really help us. Now, if we're drinking a lot of water really quickly right before we do a lot of workout, you can think about from a pressure perspective, if it's sitting in the abdomen and then we do high intensity exercise, we have the weight of the water additionally pushing down on our bladder. So the weight of the water, we just straight pushing down. So if we're guzzling and drinking a bunch of water right before activity, that might actually make it harder. So doing simple things like going to the bathroom before we exercise, sometimes just limiting that extra weight inside of the bladder can help quite a bit. But it's typically not an issue about hydration. It's typically an issue about how we handle the intra-abdominal pressure. If we're using a lot of contraction of our abdomen, like if we're using a lot of ab muscles to contract in, especially our superficial muscles like the rectus abdominis, it can give us a lot of pressure from the front side. And if we're not also supported by having a strong pelvic floor, strong multifidus, and a strong diaphragm to help absorb and contain that pressure appropriately, that's when we run into issues. So it's typically not a hydration issue. It's typically a handling the pressure issue. That's what we want to address. And just a fun quick tip for the day, breathe out on contraction. It will help lessen and reduce the intra-abdominal pressure during that particular exercise or motion. It's just one way that we have a very simple way to help get the extra pressure out and potentially limit that amount of incontinence during yoga or Pilates or the exercise that you love.
That tip really works. Really well. I'm sorry about the echo. Okay. Okay. Well, now the comment. Apparently, everything's going live video. That's what happens when you're live.
Oh goodness.
Okay. Well, I can't show any of the comments. How about we take this last comment?
You got it. I can hear you so clear.
It's so weird. I can hear the echo, and everybody's commenting that the echo is annoying. So
shoot. Okay.
Is it normal to have to, or what is recommended? I started as a and after completing I'm 2 to 2.
Oh shoot! Sorry, I couldn't hear it. I'm so sorry. I was trying to listen, and I just missed about half of it.
So basically, should you repeat the program if you still have a gap?
Oh, yeah, absolutely. I feel like anytime that we have low internal pressure with exercises that are designed to help bring the two sides of the rectus abdominis together, you can repeat that indefinitely. There's never a time where you would have to stop it. But I think it is helpful to know, okay, are my symptoms resolved? Am I feeling like I'm strong and able to go on to the next step? That's the point that we want to really just be mindful and aware of how our body responds to exercise, and maybe look at the things we're still struggling with, and don't be afraid to just take it slow. Give yourself grace. A lot of slow progress is still progress.
Anya commented that speakers maybe. If that's what we're hearing.
My speakers are the problem? Did I make the problem the whole time?
No, it's no big deal. Oh, I don't hear the echo now. Oh, I do. Okay. Well, anyways, we are out of time. So we had some amazing questions come through. We're going to keep these in mind next week. And then you guys, every Sunday at 11 o'clock. Monique, do you want to end this?
Oh, yeah, absolutely. Okay. So every week on Tuesday at 11 o'clock, we're going to get together, Natalie and I, with very clear speakers and no echo whatsoever, and have some time to talk about these really maybe not difficult or complicated, but things that we don't talk about all the time. Especially as women, we have to support each other, give each other all of the resources that we can to help us feel strong and stable and confident. And when our bodies are feeling better, everything else works so much better. So have a great day. We'll see you later, and we'll see you right back here next week to do the same thing. Bye-bye.
Awesome. I appreciate you guys. Have a great day. Oh my gosh, Monique, I'm so